Hey guys, so the footage you are about to see was taken on Wednesday. Today is Friday. It is 2:10 p.m. and the video that you're gonna see was taken on Wednesday. And I just want to explain a little bit before you get into it. Explain a little bit about what is happening there, because I have a feeling it might scare the crap out of some people. And you don't need to have the crap scared out of you. So I have a video up about convulsive syncope. If you want to watch that, I recommend doing so. You don't have to watch that before you watch this, but that is what's happening. This is actually convulsive syncope on camera. Something that happens to me sometimes is when I come to from passing out or almost passing out, so syncope is fainting. So sometimes I will jerk and convulse like you see in the video, and sometimes it looks like I'm having a seizure. I'm not. It's kind of probably just my body's way of trying to get the blood back where it's supposed to be, and my body trying to level everything out in a kind of an abrupt, uncomfortable way. And so that's what you're gonna see here. We made an ER trip because I was passing out way more than what is usual for me, and we wanted to help me get more stable. And one of the best ways to get somebody with dysautonomia more stable is to have an IV, saline IV, because fluid and salt are kind of two of the most important things. And since I was having a severe flare, we wanted to get me an IV. And so we took me to the ER. My boyfriend met me there because he is really awesome. And unfortunately, the fluorescent lights that were at the ER triggered the convulsive syncope, because I was not convulsing like that until I got to the ER, and they would not allow me to turn the lights off. We did have something over my eyes for part of it, but it couldn't stay there because I was convulsing, so I would convulse and it would fall off. But yeah, I just wanted to explain before you see it that I'm not in danger. It is quite painful sometimes. Sometimes I will pass out and then wake up gasping with my hand on my heart, because POTS can cause severe chest pains. I don't think I do that in this part of the thing, but my mom was recording because I asked her to, and she stopped recording because I was getting worse, and she's like, okay, this is a main concern for me personally, because I have Ehlers Danlos Syndrome, and a lot of other people with POTS have Ehlers Danlos Syndrome, was I was afraid I was going to dislocate something or hurt myself. And for some reason the nurses weren't around during most of this, and we had the barriers up so that I didn't fall off of the bed. My boyfriend and mom had to put those up themselves, and they had to hold me down so I wouldn't hit my arms and legs and head and face on the metal bars. I think in the video the pads were already there, but they had to go and like yell at somebody to even like bring the pads because no one wanted to come help. It is Ehlers Danlos Syndrome Awareness Month, by the way. Yay! Thumbs down for Ehlers Danlos Syndrome, but thumbs up for Awareness Month. So here's the video. I also forgot to mention that my boyfriend noticed that every time I would convulse or jerk like that, my heart rate would spike. So there was a couple times that it went up like 15 beats in half a second. And that could also definitely be part of the reason why I was jerking so much, is because of those abrupt heart rate changes and probably blood pressure changes. I'm not sure about that because it was not constantly going, it was just checking every now and then, but the heart rate for sure went up. It would spike, and so every time I would jerk like that, my heart rate spiked, which is probably why I was jerking, because, you know, my heart rate, 15 beats in half a second, that's crazy. And again, I don't want any crap to be scared out of anyone. So just be aware that it might be a little disturbing what you're about to watch. I'm not in any danger. It is very uncomfortable. It looks like I'm having seizures at times. Just so you're aware about what you're about to watch. There you go. This is not all of the video, so if you do want to skip over that part, you can. But here you go. Are you recording?
Mm-hmm.
Oh. Ow. Jeez.
What?
Are they getting what I mean?
I don't know what they mean.
This light probably is a little bit.
No, you know what? It's making it worse.
Hi. We got this is the second. Yes. This is the second bag. Is it like halfway done or?
More than halfway.
Okay. But yeah, a lot better.
It is done.
It is done.
Wow, that was fast.
Show them it.
Yeah, I won't do that on it yet.
Oh, feeling a lot better now. I have this on my face because
On the fluorescent light.
yes, those fluorescent lights are not good. And this is John. Show John. He's really wonderful. And that's my mom. Okay.
Okay, sweetie, can I see it?
Hi, Mom. Okay. Bye.
Hey, babe.
So the reason we came here is because I was passing out a lot more than usual. And I'm doing better now. And I'm really happy that he's here. He's really nice. What?
Are you recording?
Yeah. Love it.
Love
So,
you too.
the last time I saw a doctor was like 2.5 hours ago. He got mad at me and my mom, and he was like telling us that we were putting him in a situation that he didn't want to be in, and he was like mad at us, and that was the last time I saw a doctor. Haven't seen one yet.
Now it's 9 o'clock, and it was 7 when we last saw him.
It's past 9 o'clock.
It is 9.
It's almost 9:25. The last time we saw a doctor was at 7, because he got mad at us. This is like a different doctor. I haven't seen the new doctor at all. But we're just waiting for discharge papers.
Yep. So we can get out of here. I'm saying we can just bang your dad,
No.
but that's illegal.
I kind of feel like they forgot about us. That's what it is. So yeah, it's been almost 2.5 hours since I saw a doctor, and I feel like they forgot about me. Fun times.
Never know.
I'm really ready to go home.
You know what's funny?
Huh.
People over there came in after us, and then they left before us.
There was 2 people that came in before us. Well, there was 2 people that came in
Yeah, there was
after us and left before us. But at least there's a lot of nice nurses.
Yeah, the nurses are really nice.
pretty much all of the nurses are really nice.
The dude with the mustache.
Oh, I know. He's funny. Oh, it's rolling. What did you think about the doctor earlier?
You know, at first he was being pretty reasonable about everything.
He actually knew what dysautonomia was, which really surprised me.
That was the surprising part. The only part that I didn't really like was that he was kind of being arguing about stuff.
He was arguing with my mom, and he was actually refusing to talk to me. I had to yell at him to get him to look at me and talk to me because he didn't want to talk to me. I had to yell at him to get him to talk to me or even like pay attention. But
Yeah.
look, it's been quite a while since any of the nurses have come to check on me either.
That's true. Normally, the nurses should be like checking on you at least like, I would say 10, 15 minutes.
Yeah.
Even 20.
No one has come to check on me in quite a long time.
No.
And I'm ready to go home. I've been ready to go home for a long time. And they just haven't not come to check on me.
We're wondering
I hear my mom.
they were going to send her home. She's going to start being sick again for some reason. So we need to go home. I'm done with that.
The fluorescent lights make me sick. So if I don't go home soon, I'm gonna get sick again.
Okay, alright.
I think they're getting the discharge instructions.
We're waiting for the nurse.
So what happened?
Waiting for the nurse to catch up on discharge papers.
Waiting for the nurse. Discharge papers? How long does it take?
Discharge papers.
Everyone else did. I'm the only one that didn't get discharge papers. It's really fun being dysautonomia patient.
Especially since you have school tomorrow too.
I have an essay due tomorrow. I have to write the whole thing tonight.
Crazy.
Then 2.5 hours since the doctors come. All the other patients got discharge papers. And all the other patients had nurses come to check on them. They have not come to check on me, and I have not gotten discharge papers.
I'm gonna go use the restroom.
Have fun with that. It's a little bit after 9:30 now, and they just took out the
They
IV
just
thing.
took out the IV.
Yeah. And so, they took off the IV and they took off the heart rate monitor. Well, it was on my thumb. The heart rate monitor and the electrode things. I still have it, like the sticker things, but I can just take those off later. Hopefully, I get to go home later. Look at my shirt. I am a dysautonomia warrior. It's not for the weak. You look at my shirt. We have to go home. Right?
No, we get
Do
to
this. I finally met the doctor by like a minute ago. I met the doctor.
This doctor was much nicer.
Yeah, he was. Even though I just met him. Yeah, we're done.
Yes.
Huh? Yeah, I signed the thing. We're done. Okay. Yay. Well, we're home now. We've been home for a while. I ate have a burger salad. And
We are very glad to be home. It was quite an experience. I had a mom moment with the mom next door. She had a toddler who had cut her toe, and she had been waiting since 4 o'clock in the ER. It was about 6 or 7 at that point, and she had not been treated. Aubrey was flopping around in the bed, passing out, having what looks like seizures. We knew they weren't seizures, but they were pretty bad.
would you say it was convulsive syncope?
It absolutely was. And
Convulsive syncope caught on camera.
we had to put the rails up ourselves on the bed and put our hands around so she doesn't hit herself on the rails.
So I don't know if in the video if the pads were there yet, but my boyfriend and my mom had to hold me down so that I wouldn't hit my head on the rails or my limbs or anything. And if the rails wouldn't have been there, I would have fallen off the bed. But no nurses or anybody wanted to come and help do that. So they had to do
I
it.
finally went in and I walked into the nurse's station, and there were 3 nurses there on their computers doing paperwork. And I went and I told them, my daughter is in crisis. We need help now. All she needed was a bag of saline. And they were dragging it out and weren't giving her any attention. So finally the doctor came in and saw her, and we had already had
He started yelling at my mom.
I did not want them to draw blood because she's already had blood drawn twice in the last week and didn't need any more blood drawn. We felt that would add to the problem, and so he yelled at me. And meanwhile, the mom next door with the little toddler heard all of this, and we all thought this was crazy. And we won. We didn't get the blood drawn.
My mom said that she was a little embarrassed because she didn't realize that the mom next door heard her yelling at the doctor.
But she was in complete sympathy after sitting there for however many hours with her little girl with a cut toe that just needed like 2 stitches.
She was like listening to.
Yes. So in the end, it
She
all
had a
worked
mom
out.
moment.
I asked for potassium. They were going to give her potassium along with the IV fluids, the saline. Did not get the potassium because he was mad at me at that point. But she did get 2 bags of saline, which perked her back up.
So what we asked for was we asked them to put, because there's different amounts of sodium that you can put in the IV bags. So we did ask them to put the maximum amount of sodium in the IV bags, because if you're familiar with POTS, you will know that pretty much the 2 most common treatments for POTS is high fluid intake and high sodium intake, which is why the IV saline is so magical, because of the sodium and the fluid. So we did ask them to put the maximum dose of sodium. They refused to do that. And they also refused to put the potassium. The reason we wanted the potassium is because my doctor who treats me, normally, he's my neurologist. We're going to be referred to a infusion center in a town about 30 minutes away from us. And when we go there, he wants to have them put potassium in the IV bags. So we told the doctor that, and they refused to do that too. So
At least we got 2 bags of saline.
yeah, it was great that I got 2 bags. Last time I only got 1
You
bag.
only got 1, yes.
And 1 bag did help, but 2 is great. But yeah, he was yelling at my mom. And I also told him I was having a problem with the fluorescent lights, which could have been why, because I was not having convulsive syncope when I first got there, but I definitely think that the fluorescent lights probably triggered the convulsive syncope. Because I was already in like a flare, but at that point I was not convulsing that much. I was still convulsing, but not to the point where I was going to injure myself, because I did actually hurt myself several times. I think I dislocated my hip once or twice, and my knees. I hit my feet 2 or 3 times, and another time I hit my shin, so I'm probably going to be bruised tomorrow. I hurt myself a lot, and again, the nurses were nowhere to be found during that.
Crazy.
And he was yelling at my mom saying, I don't trust the sodium, I don't trust the lights, I don't like this, she has to have a blood draw. And I was trying to get him to listen to me, and I was like yelling at him like, hello, hi, can you talk to me? Hi, please, I'm right here, please talk to me. And he finally did look at me, and I said, I don't want to have a blood draw, it's going to make me more sick. And he looked at my mom and he said, fine, but what did he tell you? He said,
You're signing out that you refused to let me treat her. And I said, okay. But then he went off of his shift and we never saw him again, and we didn't sign anything.
and the next doctor didn't come to see me until I was being discharged.
Right.
This is why we need more dysautonomia awareness.
Yes.
Because this is not proper health care at all. This is not okay.
No.
And by the way, the reason why I was dislocating so many things is because of I have Ehlers Danlos Syndrome. And it's actually Ehlers Danlos Syndrome Awareness Month.
Well, you know.
I don't know if this is proper time to do thumbs up.
Are we done now?
Yeah.
I'm done.
Thumbs up for Ehlers Danlos Syndrome?
I
No,
don't know.
not really. Thumbs up for Ehlers Danlos Syndrome Awareness Month.
Awareness Month.
Thumbs down for Ehlers Danlos Syndrome, but thumbs up for Awareness Month, so that's good. We've been doing this for 7
Yes.
minutes.
Okay, we're done.
Wow.
Bye.
Well, thank you for talking.
Right.
Okay. Bye. Bye. I love you guys.